Today's webinar. We're going to go ahead and get started. Our webinar today is being co-hosted by Healthy Schools Campaign and the National Association of School Nurses, and it's also being done in conjunction with the National Coordinating Committee on School Health and Safety. And our topic today that we'll be discussing is the Affordable Care Act and school nursing. So thank you again to everybody for joining. Before we go ahead and get started, we just wanted to walk through a few logistics for today's webinar. Our webinar is going to run for about an hour, and we will be posting a recording of the webinar online by the end of the week, and we'll include all the presenter slides from today. And everybody who's participating today will get an email with a link to that recording and the slides so you can access them. Also, we have a very short survey at the end of the webinar that we would greatly appreciate you taking a moment to complete. We'll be saving the last 15 minutes of the webinar for a question and answer session. Please feel free to type in your questions throughout the webinar and send them in during each speaker's presentations. We'll be compiling them, and then we'll be sure to ask all our presenters those questions at the very end. We have two wonderful speakers joining us today. Again, sorry, my name is Alex Mays, and I am the Senior Policy Analyst at Healthy Schools Campaign. I'm going to be joined by Erin, Maughan, the Director of Research at National Association of School Nurses, and Fekaris, who is a school nurse with Beaverton School District. Before we hand it over to Erin and Nina, we wanted to tell you a little bit more about Healthy Schools Campaign and our work on this issue of the Affordable Care Act and school nursing. Healthy Schools Campaign is a nonprofit organization based in Chicago, and our work is based on the simple common sense notion that healthy students are better learners. We want to make sure that all students and staff have a healthy school environment in which they can learn and work. And to us, that means making sure that they have healthy food, opportunities for physical activity, clean air to breathe, clean water to drink, and one of the core issues for us is making sure that they have access to a school nurse. And that's why the topic today at hand is so important to us. With the Affordable Care Act and the transformation of our healthcare system, we know that there is a shift from focusing on the treatment of diseases to focusing on health prevention and promotion. And we really want to make sure that the role schools can play in that transformation is recognized, and that the role of school nurses in delivering health services is recognized. This has been an issue that we've been working on for the past 2 years, primarily through our Health in Mind effort. In 2012, we launched this effort, which brought together over 100 stakeholders to really discuss and identify opportunities and strategies for how the health and education sectors could better work together to support school health. The issue of how we could support school nurses was core to this work, and we had the opportunity to present our recommendations to Arnie Duncan and Kathleen Sebelius in May of 2012, and that's what this picture that you see now is from. Our recommendations from Health in Mind really fell into 5 buckets. We wanted to identify opportunities for incorporating health and wellness into professional development programs for teachers and principals, for integrating metrics and accountability, for integrating health and wellness into education metrics and accountability, for making sure we have recognition programs that acknowledge schools that are doing an exemplary job in supporting school health, for making sure that there's the institutional capacity at the federal level, at the state level, at local levels, to support the intersection of education and health and make sure that health is integrated throughout education programs and policies. And last but most definitely not least, we included recommendations for how we could increase access to school health services. And specifically, these are the recommendations that we included in Health in Mind. We looked at the barriers that exist for school nurses and for school health services in getting reimbursed from Medicaid. We want to make sure that in order to fully support the role that school nurses can play within the Affordable Care Act, we want to make sure that they can bill for the services that they're providing not just to students with IEPs, but to the general student population. We also wanted to make sure that schools are recognized as an eligible community benefit. One of a key provision in the Affordable Care Act was increasing the requirement for nonprofit hospitals to provide benefits back to the communities that they serve. Traditionally, this has looked like the hospitals providing free services in their buildings, but the Affordable Care Act really challenges nonprofit hospitals to think beyond their hospital walls and think about how they can provide services that benefit that serve the community outside of the hospital and the communities that they see in those hospitals. And we really want to encourage schools to be recognized as an eligible community benefit and encourage partnerships between hospitals and schools that can really support the delivery of school health services. And finally, we wanted to make sure that there's a permanent place to have these types of conversations, and that as the Affordable Care Act moves forward with being implemented, that there's a space for the health and education sectors to come together to have these important conversations and think about how health and education can work together to support school nurses and to support school health services. So as far as where we are with implementing these recommendations, in February, we launched the National Collaborative on Education and Health, which we hope will be that permanent home for these types of conversations. This group is overseen by a steering committee of over 20 national health and education leaders who are going to be working to really identify the opportunities for health and education to work together to support the conditions for health in schools across the country. A key focus of this group is going to be looking at the Affordable Care Act and identifying opportunities for health and education to work together. So looking at states that are rolling out accountable care organizations and thinking about how school nurses can be included in the financing and delivery models of those accountable care organizations and things like that. And additionally, we are working on an issue called the free care rule, which is one of the primary barriers that we identified through our Health and Mind work that's preventing the billing of Medicaid for services that are delivered in schools by school nurses. This is an issue that has actually been found to have no legal basis, and the Department of Health and Human Services Appeals Board has actually ruled that schools should be able to bill Medicaid and that the free care rule does not apply to schools. So we've been asking the Centers for Medicare and Medicaid Services to issue clarification that schools can in fact bill for these services so that school nurses can have additional resources that they need to be providing services to students. You can read more about our work on our website here. One of the key things that we also took away from this process is that there's some phenomenally innovative work that's taking place across the country to support health through education and to support the collaboration between the health and education sectors. We feel like our challenge now is to identify the best practices that we've learned from those innovative efforts and share them and support them and engage in a national dialogue about how we can better support education and health working together and supporting healthier school environments across the country. Our two speakers today, we feel so fortunate to be co-presenting with them. They embody so many of the principles that we shared in our Health and Mind report, and we are very excited to have them presenting with us. We have Erin Maughan, who is going to be speaking a little bit about the Affordable Care Act and specifically some of the ways that the Affordable Care Act supports can be used to support school nurses. And Fekaris from Beaverton School District is going to be sharing an innovative effort that they've been leading in the Portland metro area to really include school nurses in the delivery and financing model that is being set up within Oregon. So we're excited to share their work. We have learned so much from both Erin and Nina in our own work and are excited to be presenting with them today. So before I hand it over to Erin, I will introduce her. We wanted to ask a quick poll question of the audience. We want to know who is out there so we can see who is in our audience. So please take a moment to tell us who you are while I intro Erin. Erin Maughan currently serves as the Director of Research at the National Association of School Nurses. Dr. Maughan has a long history in school nursing, having worked as a school nurse and later serving as the State School Nurse Consultant for the Utah Department of Health. Prior to joining NASN, she was faculty in the College of Nursing at Brigham Young University in Utah, where she was a tenured associate professor teaching public health, community, and global health nursing. We are excited to have Erin joining us today. And before I hand it over to Erin, we want to share the results of the poll just so we know who is out there. So they will be appearing on your screen. So it looks like, no surprise, I suppose, 3/4 of our audience are school nurses, which is wonderful. And then we have some government employees, some nonprofit advocates, and a mix of others. So thank you again for all joining us. And without further ado, I will hand it over to Erin. So take it away, Erin.
Great. Excuse me. Thank you, Alex. And first, I just wanted to thank Healthy Schools Campaign for co-sponsoring this with us, the National Association of School Nurses, on an issue that is passionate for both of us. I also want to say thank you to our listeners, and I'm thrilled that the majority are school nurses. That actually makes me feel more relaxed because I feel like I'm working with fellow colleagues. So my portion today is to talk about the Affordable Care Act and how it relates specifically to school nursing. If you can advance to the next slide, please. And in particular, I'm going to do an overview but give a few examples, but then that's why Nina is here, to provide some really great examples of what they're doing there in Oregon. And then at the end, there will be time for questions and answers. So if you can hold those questions, and they'll explain more of that at the end. If you can advance to the next slide, please. So just overall, there's three main components of the Affordable Care Act, generally speaking. And these are the three that are listed here. And I'm going to focus mostly on the first two just because they're the ones that relate specifically to school nursing, and I'll get more specific. But just wanted as a general overview, we hear the Affordable Care Act called that all the time, and we know it's a huge document, but I thought it was important just as a refresher just to remember what it really is all about. And first is to improve quality and lower the cost of healthcare costs. This includes coordination of care, electronic healthcare records, and use of IT, as well as promotion and wellness. As you can see, a lot that school nurses already do. So I'll talk a little bit about that in just a minute. The second area, which is increased access to healthcare. This, of course, and Alex has touched on this already as well, is the expansion of Medicaid and making sure that those who are eligible really do have access to, for children, because that's what we do as school nursing, is with Medicaid or the state child health insurance plans. So I'll talk a little bit about that as well. And then the third area provides new consumer protections. This doesn't have as much to do as school nurses in our practice, although it might personally in your lives, but it focuses on the areas in regards to what benefits people have, allowing young adults to stay on family insurance plans until 26, some of those areas that are very important, but more in our personal lives, not in our roles as school nursing. So if you can advance to the next slide. What I'm going to focus on then are these three areas because I feel they're the ones that have the most to do, that are applicable to us as school nurses. And I'm going to do them in this order, mostly because care coordination there's the most about, and that feeds well into what Nina is going to talk about. But I think all three are really important. If you can advance to the next slide. So access. And this is access to care. The statistics that are shown here are actually, and what my point I'll just say right up front is, as you know, I'm the researcher for school nursing for the National Association. You might wonder why I'm doing the presentation. I do have a great passion for policy, but also I wanted to make the point that there are actually a lot already being done, and as you know as school nurses, that in many ways we're already doing many of the things that the Affordable Care Act now emphasizes. And that's part of my point, is that this isn't a call for a complete change in what we do as school nurses, but it's more about being able to articulate what we do as school nurses and how we already fit into what the plan and the idea is. And in this first area of access, it's really important. These are statistics from our 2013 school nurse survey. And it shows that of the participants that completed the survey, that 45.6 of them are already doing some type of an access and outreach to help the students that they work with obtain Medicaid or their state insurance plan. I'm not going to read each bullet, but you can see them here that not only are school nurses doing that, but even many more are working with students to help them get free or reduced cost health care, maybe if they don't qualify for Medicaid for some reason. They also work not just in getting them into insurance, but also providing the care that they really need, either by helping them connect with school-based or federally qualified health centers, or even if the family has insurance, but maybe they're having a trouble finding a provider that will accept the insurance. Over half of our participants indicate they already are doing this. So you can see this is a role that school nurses already do. Excuse me. I also wanted to mention we did ask about how many school nurses are currently billing for Medicaid services for reimbursement in their schools, and over half, it was 59%, bill for some type of Medicaid. What was kind of interesting in the survey that I think might be part of something for school nurses to look into is how are those reimbursements coming back. Some areas are using that funding to increase the school health and school nursing services that are available, but some are not. In fact, less than 10% of those that we surveyed knew for sure that the money was coming back directly to support school nursing. Now, that's okay. The law doesn't say it has to all go back directly into school nursing, but it was kind of interesting that since school nurses are the ones, excuse me, that are doing the, are able to bill to be reimbursed, that not all schools are realizing what an advantage that is of a way of getting more school nursing services in their schools. So just something to think on, and if you are doing that already, we're going to ask you about this later. We'd love to hear more. If you can advance to the next slide. Okay, so the next area is with health promotion. The Affordable Care Act put a lot of emphasis on promotion, prevention, wellness, again, something that school nurses were already doing. So this is not to say we need to stop what we're doing, but just to continue and to articulate what we are doing. Although I do have to say that on a survey, that same survey, the school nurse survey that we did, our school nurses said they would love to be doing a lot more of this. And I think it's something that maybe as things transition, there'll be more opportunities. On the slide, the information there are some studies. The first 3 bullets come from the research from TIFA, which is the Trust for Americans' Health. And it was a study that was done and published in 2008, and it was focusing on more community-based areas of how, mostly with physical education, nutrition, smoking cessation. But when that went, for every dollar that was put in for those types of services, they found that there was a $5.60 return rate for the services in prevention. So it's saving money, which is why it's probably in the Affordable Care Act, because they see it as a way to save money. I actually misspoke. Just that bullet is from TIFA. The next ones actually came from a campaign that the American Public Health Association was doing that showed also some return on investment for putting into other areas of health promotion that school nurses often work on. I just pulled out the ones that school nurses oftentimes will work with. And even though it's written in a different way with immunizations, which I know we oftentimes track, it really does save $9.9 million in direct care in our healthcare system. So we as school nurses know it saves money, but I just wanted to put the statistics here to help you see how much it really saves. The last one is actually in an article that will be published soon, and it was done using data from the state of Massachusetts, who collects a lot of great data with school nursing. And they found, and this is actually on clinical services, not on the prevention side of it, but they found just having, for every dollar that was put in for school nursing, to fund school nursing, that $2.20 was saved. So again, school nursing is a great return on investment for their clinical side, as well as for the great things they do with health promotion and health prevention, which is part of the Affordable Care Act. Can you advance to the next slide? Thank you. I just wanted to share another example. This one was actually with school-based clinics, which are doing some great things too, and it was in New York. And I apologize if I pronounce this wrong. I heard it, the group presented at a presentation I was at, but I always have difficulty with names. So I think it's the Montefiore, I apologize if I said that wrong, Medical Center. And they've partnered with school-based clinics throughout New York City. And what I wanted to show here is this first one was with health promotion. They do the acute care side of school-based clinics, but as they looked into it, they saw that they could do some other health promotion activities in the school. And one of them was that they noticed that whole milk was the only option for the kids at school, and they wanted to change that because the concern with obesity. And so they worked with the school, and they were able to actually get that low-fat option of milk, and that being the only option, and getting the whole milk out, which was a great win. They've also done some education as well, and they've also, on top of it, as we move on to the next area, which is coordinated care, I wanted to point out here a nice example of how the coordinated care they were able to provide through the school-based clinic for students that had asthma, that the outcomes, both from an education standpoint as well as from a health standpoint, were great. They were able to reduce hospitalizations and emergency room visits by 50%, and on top of that, were able to increase by 3 days per year improved attendance for children or students who have asthma that were missing school because of asthma, which is what school nurse is all about, is making sure the students are there and ready to learn. So kind of that moves us into the next area, if you can advance the slide. And we're all focused the rest of my few minutes on, which is about care coordination. I thought this was a great quote at the top that the American Nurses Association indicated, and fits really well with what school nurses do, though. That's what school nurses work with, are the complex cases oftentimes. Many of our students have multiple chronic conditions, and it's the school nurse that helps coordinate and make sure that the student is getting the services that they need. And because I'm the researcher, I have to also point out, again, this is not a new thing that school nurses just started doing because of the Affordable Care Act. It's actually been part of our job for a very long time. I don't know since when, probably from the beginning. And here are two studies that show, from a research perspective, that having a school nurse involved as the case manager, as the second bullet shows, or also just involved with asthma management, that they have been able to improve outcomes with asthma and decrease absenteeism. So we have not a lot of data, but we do have some data which can help us as we are articulating what a school nurse does in coordinating care, which is a huge part of the Affordable Care Act because it talks about using funds and resources efficiently. Julia Lear, in an article that was done in 2007 in Health Affairs, talked about how school health is kind of the hidden healthcare system, and I think that's true. A lot of people don't realize all that school nurses and others are doing in the schools, and I think care coordination is one of those areas it's not realized all that school nurses are doing and the potential that has as being part of this whole reform in healthcare. If you can move to the next slide, please. Just wanted to share just a few examples before we turn the time over for Nina to really share some exciting things. And for one of the solutions, I'm going to talk about several things of how care coordination is being addressed. And one way is just actually it's becoming a new way of funding school nurses. Alex talked about how the community benefit with nonprofit hospitals and how they're looking to look out into the community and wanting to be more involved in school health and school nursing. Others, hospitals or healthcare settings, are also noticing that work that can be done in the community can help with decreasing readmission, which also decreases the cost. And so there's examples of how, one example that I'll share and why the state of Maryland is here is because in one county, and it's too early for the outcomes, but we know in at least one county that the hospital system now has the contract for school nursing. And so they actually, the school nurses are employees of the hospital healthcare system. And with that, they see it as a way of being able to decrease readmissions. As I mentioned, it's kind of new, so as far as I know, there aren't outcomes about that yet, but it's something to look at. And this isn't necessarily just new here. If you want to advance to the next slide, please. One example that's been going on actually well before the Affordable Care Act, but was kind of that same idea of coordination that I think we can learn a lot from, is down in Austin, Texas, where the Seton Healthcare family contracts with the school districts in the area, and they've been providing school health services for a number of years. With this model, being employees of the hospital and the system, it gives them access to many more health resources, such as the physician's medical director, so the pediatric clinic, some specialist things on that, and there's a focus on wellness, health promotion, and prevention, which are key parts of the coordinated, or I'm sorry, of the Affordable Care Act. Although, like I say, this was actually established well before the Affordable Care Act. I just wanted to share it as an example of a very successful, different model of funding school nursing. So if you can move on to the next slide. Okay, I also just wanted to touch on two other areas of how school nursing is involved with coordination efforts in this idea of coordinated care. First, also part of the Affordable Care Act is an increased emphasis of using IT and information technology, electronic health care records, because it opens up ways of coordinating. And one area where it has been very successful is in Delaware with the Nemours Children's Health System, where the system and the school districts in Delaware have been able to work together, and they've made sure it's HIPAA and FERPA compliant and with parent permission. But they now have the opportunity that school nurses actually have access to the provider's records. They're electronic, so this really helps. This has been great. As one school nurse shared with me, What she found great about it is it helps increase communication in many ways. Before, they always relied oftentimes on the parents to deliver information back and forth after there'd been a checkup, where this way the parent tells that the school nurse that there's been the visit, and the school nurse can actually get on and look at the records, and they've been able to really see exactly what's happened, where before the parent might say, yeah, everything was great, you know, we're moving ahead as is. The school nurse can go on and say, well, is it great, or maybe the A1C wasn't as great as maybe had been applied by that term, but she can actually look at the lab values, can see if there's medication changed. It seems to be a win-win situation where they're able to really provide and coordinate care so that they're working really as a strong team. For this reason, I also just want to mention that the National Association of School Nurses, in conjunction with the National Association of State School Nurse Consultants, we are working jointly as a group to develop a uniform school nurse data set so that all school nurses can collect information the same way. We'll talk about it more as it rolls out. It's kind of a new process, and we realize that many states are already collecting great information, but we find that with this push on coordination of care and standardized language, it's an opportunity to really increase the visibility of school nurses and being able to show that school nurses already see about 97–98% of all students already, and with the data it would be, of course, none of it would be personalized data, it would be aggregate data, but it would be an opportunity to increase the ability to share data as well. So that was a way that NASN is working to really be part of the Affordable Care Act. And then the final area that I wanted to mention was in regards to telehealth. Oftentimes, traditionally, telehealth, we think of maybe a clinic in one area connecting with a clinic in another area. But there are actually some models out there where it's school nurse driven, where it's the school nurse on one end who's working in her role as a school nurse, but has set up with a partnership with providers in a remote area. This works particularly well, of course, maybe in rural areas, but it doesn't even have to be rural. It's just an opportunity to make sure that the care the child and student needs is being done, and the school nurse is right there to facilitate it. It's been very successful in the models that are out there. So I just wanted to share that as another way of how school nurses can really coordinate in care. Can you advance to the next slide, please? And this is just because I'm a research nerd, I had to show you the references in case people are interested in the information that I shared.
Great. Thank you so much, Erin, for that wonderful presentation and for really setting the foundation for Nina's presentation, and I'm sure giving people lots of things to think about. We would please feel free to send in your questions about Erin's presentation. We'll be collecting all those questions and getting to them at the end of the webinar. So I will now introduce Nina Fekaris, but first we want to ask another poll question of the audience out there. We want to know if you know of outreach efforts in your school to help students obtain insurance. We heard from Erin about how the Affordable Care Act expands Medicaid, presents new opportunities for making sure that students are insured. We want to know if you're aware of efforts out there to make sure students are insured. So I will now introduce Nina. Nina has been a school nurse for 25 years, and she is currently a school nurse in the Beaverton School District, which is located in the Portland metro area of Oregon. She was selected as the National School Nurse of the Year in 2009, and she currently serves as Oregon's director of the NASN board and is serving on the executive committee. We are so happy to have Nina joining us today and to hear about the wonderful work that she's been leading in Oregon. So now we will share the results of our poll, which is great. It looks like over half of you are aware of efforts that are going on in your school to obtain insurance, and some are in the process of doing it, which is great to hear. And I'm sure if people have questions about resources or best practices for doing that, that would be a great question to ask at the end of the webinar. So I will now go ahead and hand over the virtual gavel to Nina Fekaris from Beaverton School District. Nina, take it away.
Okay, thank you, and thank you for inviting me to participate today as I get to share some of the opportunities that school nurses have in relation to the Patient Protection and Affordable Care Act. Next slide, please. So I'm going to begin with my conclusion, because if there's anything you take away from my presentation, it's this: connections really are key. You don't have to be an expert in the Affordable Care Act. I wasn't. I'm certainly still not. But you do have to go beyond your school community. You do have to work a little bit extra hours. You do have to attend those community meetings, and it's vital that you make those connections and cultivate those key relationships with the people that will help you in your area. Next slide, please. So Erin did a fantastic job talking about the Patient Protection and Affordable Care Act, but I just wanted to share with you, this is what I knew about it when I kind of started this endeavor, and this is kind of what I still know about it. I know that the goal of the act is to increase the rate of health insurance coverage, and I know that we were doing that. A lot of school nurses did. In Oregon, we helped families sign up for care. I know that it's one of the goals is to decrease the overall cost of health care, and I know school nurses do that. We do all sorts of prevention, health promotion, immunizations, we do all that kind of stuff. Another goal was to improve health care outcomes, and I think it's kind of a no-brainer, the school nurse's role in our health care outcomes, and then to streamline the delivery of care. All of the things that I think as a school nurse we're involved in and well understand. Next slide, please. So I wanted to share just a little bit about Oregon. So in Oregon, we have a little over 500,000 students, K through 12. We have 199 school districts, and there's approximately 230 school nurses in our state. We have a pretty abysmal student-to-school nurse ratio. Most of our school nurses work as consultants. We develop the health care plans and emergency care plans and then go into the schools and train and delegate unlicensed assistive personnel, secretaries, instructional assistants to perform that care. What is unique about Oregon, however, is how our governor decided they wanted to implement the Affordable Care Act. Next slide, please. So a lot of groups did the accountable care organizations, and in Oregon they developed coordinated care organizations, or CCOs. And when they first started talking about this, they held town meetings throughout the state. And this is one of those times when another school nurse and I decided, you know, we should probably go to one of these meetings just to see what they were talking about. So it's one of those times where we had to go outside the workday to learn something that was important for school nursing. We attended this meeting in the evening in the metro area, and when we were there, we met an individual that we knew very well. She was one of the founding members and coordinators of the Healthy Kids Learn Better Coalition, and once again, like I said, connections are key, because she said, hey, you guys are school nurses. I need you to talk to this individual. So after the meeting, she introduced us to this individual who had presented on the coordinated care organization. And within the next week, we were sitting down meeting with the medical director and the medical board of the community care organization that would handle all of the money for the metro area, which is quite a bit of money. What I needed to learn is what on earth the CCO was all about. And this is what I discovered. In Oregon, the goal was to change the healthcare delivery system to ensure that every Oregonian had better health and better health outcomes, that they received better care at a lower cost. So when we began meeting with them, I realized, okay, school nurses, we have an impact in some of those areas. Next slide, please. So we began to talk to them about a pilot project. Like most professions, the physicians have a number of metrics and rubrics that they must meet to be able to get reimbursed. There's also a big pot of incentive dollars. And so what the CCO was most interested in is, one, lowering cost, but two, how can they get a hold of some of these incentive dollars for the physicians? One of the areas there were hundreds of areas that school nursing could impact, and we decided to look at just 3 to begin the pilot. One of the key for the physicians in our area was ADHD follow-up. They needed to be able to get behavior checklists after medication was changed, 30 days, 6 months, and 9 months after a new med was started or a dose was changed. And the physicians are saying that, they had no mechanism to get those checklists. Now, in Oregon, school nurses don't really do a lot with our ADHD students. There's just not enough of us to be able to do that. But we decided, okay, well, this is important. And so for a while, we would try to provide school documentation. We could talk to the teacher and get these checklists for the physicians if that would help them out. And obviously, asthma management was another one. The metrics, of course, is to decrease ER visits. And we asked the medical director, would it be helpful to you if you knew when your client, our student, was using their rescue inhaler more often, when they needed it before PE or after recess, when their peak flow measures were going in the yellow and red zone, and their eyes lit up and they were just like, yes, it would really help us if we knew that. So we knew that we had that hook with them as far as asthma management, and we would be able to provide that information for them. Next slide, please. And the last area that we really needed is we really needed better communication with our students with diabetes. We needed to be able to get a hold of those physicians and really help be a little more flexible with our insulin dosing at school when a school nurse is coordinating and administering that insulin. And obviously then the CCO was able to meet that back with the hemoglobin A1C control metrics, and so we were able to look at that. The things that we discovered that were key as we started this pilot is that we really needed the physician buy-in, that the information from the school nurse was important and that relationship was important. And so the physicians are the ones that initiate getting the HIPAA and FERPA releases of information signed by the parents. If the physician talks to the parent and says, I really need to be able to communicate with your school nurse, so far we have never had a parent say no. And so we felt that that was a huge victory. One, for the physician to identify us as an important part of their healthcare team, and for the parent to recognize that. The other thing we also found that's key, and Erin touched on it a bit, is we really needed much more open communication lines with our physicians. And so what we're trying as a part of this pilot is they're giving the school nurse permission to access their electronic health record system so that the school nurse can view progress notes, clinic notes, and most recent orders. And then the school nurse is able to document in a section that the physicians can see any school nurse concerns or observations we've had at school. And that has been, that is one of the key things that school nurses felt was important to be able to institute with our physicians. Next slide, please. So why is it that we felt that it was important to participate in this pilot and try to partner with our community care organization? Well, I am a firm believer that school nurses should partner with physicians in providing health care for students with chronic and acute medical conditions. Really, we are part of the healthcare team, and I think we need to be recognized as such, and it's key that we be able to share that communication link with physicians. And then the second thing, I firmly believe that healthcare dollars must begin to be a part of the funding stream for school nursing services. Education dollars can no longer fund us alone. We are helping lower healthcare costs, and so some of the cost of our services need to be healthcare related. We are looking at reimbursement for school nursing services through our CCO. We are hoping that we can prove to the physicians that we are making a difference in their practice and helping them meet their metrics so that the more incentive dollars are coming into the CCO, and then we are going to turn around and ask the CCO to fund more school nurses with some of those incentive dollars. We're also just met last week with one of our state senators who's very interested about working with school nurses and insurance providers. And she is going to host a summit between the school nursing leadership in the state and some of our big health insurance providers to see, is there a way that insurance companies would be willing to kick in a few dollars a child or a student into a fund, kind of a per capita sort of funding mechanism that then could be used to help fund school nurses. So another kind of innovative new idea that's coming out of these conversations that we've had with our community care organization and with those individuals. Next slide, please. So like I said at the beginning, really connections are key. If it hadn't been for our relationship with the Healthy Kids Learn Better Coalition Director, who, by the way, is now running for our state legislature, so we have another friend in the legislature, I mean, she really opened the door for us. She introduced us to the right people and got us at the table, and I think that's what's really important. Those connections are vital for us. So identify your friends of school nursing. Talk to the people in your accountable care organizations or however your state is looking at distributing or dispersing Affordable Care Act funding. Talk to your state public health organization. In Oregon, it's called the Oregon Health Authority. And they have a lot of money. That's who school-based health centers are funded through. They have asthma grants for students. They have a new environmental health grant coming on for students with asthma management. And so we're talking to them about, maybe there needs to be a little funnel stream of some dollars coming from our Oregon Health Authority into school nursing. We've also recently, and have been friends and associated with the Oregon Nurses Association, our state association, for a long time. But honestly, most of the school nurses in our state are members of our education union and are represented by them. So we sat down with health policy people of the Oregon Nurses Association and discovered that they really didn't have a clue about who school nurses were. They were shocked when we talked about what it is that we do in schools and who it is we have taking care of our children. So now they are working on campaigning and championing the need for more school nurses. Your education unions, your state centers for nursing or nursing workforce. We've been able to present to the Oregon Center for Nursing a couple of times the role of the school nurse. And once again, they have large lobbying and political arms, and so they're beginning to lobby for us also for the need for more school nurses. Another group that we worked with was the Oregon Improvement Partnership Network, but there is a national network. Check on the national website to see if you have a chapter in your state or your area. They were key in looking at the coordinated care organization in designing systems and operation systems and the way they work better. And so we were able to get our kind of name known to that organization. So now they understand more the role of school nurses. And then obviously your local legislators, because they once again will help be your champion. Next slide, please. So what I'd like to ask you to do is embrace your position. Those who are school nurses and those who are working for the health of children, you are the expert. You might not be the expert in healthcare policy or insurance funding or reimbursement or dollar matches or any of that, but you are the expert in your field. You know school nursing, you understand your community, and you know what your students and their families need in order for them to be healthy and succeed in school. Next slide, please. And to that end, don't be afraid to share your story. It's all about students and health. Describe your practice. Talk about what you know. You don't have to come up with grandiose ideas. You just have to tell them, I'm a school nurse and this is what I do. Also, don't be afraid to talk about your failures. I shared with a group of endocrinologists in the city. I had a student who was at my high school. I serve 4 schools. I have a high school and 3 elementaries. So I have about 4,400 students on my caseload. I have 3 diabetics at my elementary levels and 15 diabetic students at my high school. And one of my high school diabetics sadly committed suicide this year. I've known him since 4th grade. I knew 2 years ago his family went through a divorce. I know he has a special needs younger brother. What I didn't know was how depressed he was at school and in his life in general. And my failure is, I believe, if I could have been at the high school more, if that maybe was my only assignment and I could have been in touch with them more, maybe I could have recognized what was going on with him before we had such a tragic outcome. If we're unwilling to say there's a problem, then nobody's going to want to help us fix it. So be willing to share some of your failures and don't be embarrassed by that. We need help, and this one way to get it. Next slide, please. And like I always remember, students come first. That's why school nurses are there, is to help the students. I believe our message is that school nurses can help lower health care costs. We do that because we provide preventative, population-based health care every day. We promote healthy life choices in the school. We work tirelessly to keep children safe at school as we plan for chronic and acute health needs. And we are and will continue to lead the transformation of school health. Thank you.
Wonderful. Thank you so much, Nina. That was really fantastic to hear about your work in your own words. And we look forward to reading more about and hearing more about your innovative pilot project that you're leading. And I think there's a lot to learn from that. We will give everybody a few more moments to send in their questions. We have one more poll question that we would like to ask the audience as a prompt possibly for future webinars that we may be hosting. We would like to know what focus of the Affordable Care Act that was spoken about today would you like to learn more about? Do you want to know more about care coordination, telehealth, meaningful use of electronic health records, non-traditional funding, or access? So we'll give everybody a few moments to send in those, send in your answers to the poll. And please send in your questions. We'll take these last few moments to ask those questions of our presenters. So now we will go ahead and share the results of the poll, or close it in 5, 4, 3, 2, 1, and share just so we can see and thank you so much for taking the time to submit it. It looks like non-traditional funding of school health services is an area that people would like to learn more about, which is wonderful to hear, as well as electronic health records. So we will be sure to keep that in mind as we are planning future webinars. So now I am going to hand it over to my colleague Mark Bishop, who is Healthy Schools Campaign Vice President of Policy, who is going to be leading our question and answer session for this morning. So Mark, go ahead.
Thank you so much. Before we get with questions, just two quick things. Reminder, we will have all of the slides as well as a link to the webinar posted on our website by the end of the week. So everybody will receive an email with the link to the archived information. So no worries, you will get all the information. The second thing, I'd just like to mention that Erin and I both sit on the National Coordinating Committee on School Health and Safety. It is a group of nonprofits and federal agencies that come together to share and expand on best practices around promoting school health, and so we are appreciative of their efforts and support and motivation for hosting webinars such as these. So let me get to the questions right now, and they have been pouring in, so we'll get to right now. First of all, let's start here. I believe this is probably best for Erin, but this one person is interested in meaningful use, and how can we be allowed into a HIPAA protected system under a FERPA protected organization? Erin, do you have an answer for that?
Yeah, I can give a general answer for that. And actually, HIPAA and FERPA, the terms get thrown around a lot like they are in opposition of each other, and they're actually not. They complement each other really well. And the Department of Education actually has developed a document that's on their website that talks about how the two can work well together. So that I just want to make sure that's clear, because a lot of times people don't realize that. And then the question being, how can you get into a system that is HIPAA compliant? That I can't tell you the step-by-steps, but we can help coordinate ways that people have done it. And it has to do with just making sure that how secure the systems are, getting the appropriate permissions, oftentimes with the parent permission or as appropriate there. And then if certain safeguards are in place, then it's very appropriate to be sharing the information back and forth. It might be helpful to remember that when HIPAA first began, the big push was actually with electronic healthcare records sharing information for billing. And now it's just kind of become a buzzword that everyone's worried about with confidentiality. And it is important, I'm not trying to downplay that, but it actually allows for very appropriate sharing of records. There is a link on our NASN website about electronic healthcare records that will give you a little bit more detail. That might be helpful as well.
And Erin, actually, if you provide that link to us, we can get it out to everyone when we do a follow-up email to all participants.
Okay.
Great.
Sure.
Okay, so how about Nina? What types of data has your pilot program having access to student physician records? What type of data has it generated? And then there seems to be a follow-up that might be for Erin of how may this become a standard also in other states? So, Nina?
Okay, well, you have to realize our pilot is brand new. We are just sort of fledgling. Right now we have an agreement with one group of pediatric physicians in the area, and we're just beginning to share information back and forth. We are hoping that we'll be able to expand it to a few more come next fall. There's one or two nurses working on it right now because they've been a part of this kind of from the beginning, and we're hoping in the fall and summer we'll be able to do some school nurse orientation. We need to get their buy-in to be able to do a little bit of this extra work for us, and so we're hoping to expand it. So honestly, right now we don't have much data. We haven't really collected any statistics as far as how much intervention the school nurse has been able to do at this point. We're hoping to have that by the end of next school year when we can really expand our numbers a little more.
Okay. And Erin, but the thought of standardization of data being collected, you might want to just speak a little moment to that, Erin?
Right, and that's kind of what NASN and other organizations are trying to do, and the standardization, that's a big push of the meaningful use, and I think getting examples of where it's working well it will really help that. That's one of the initiatives, and to stay tuned for those that are school nurses of what we're trying to do here at NASN in conjunction with the state school nurse consultants is identifying to make sure that school nurses collect data and that we are collecting it the same way using a standardized language that does talk across systems. So there's a certain finesse for that in the informaticists, which I am not, can speak more on that, but that's definitely something that we're working on because we see how important it is.
Okay, great. Here's a question that we may give to either Erin or Alex. Will you be disseminating information on the ability for school nurses to bill for services to the general population when you get clarification from CMS?
I can start with that one first, and then Erin, feel free to add anything. So the short answer is yes, definitely. Our hope is that once CMS issues that clarification, and we've heard they're close, we hope they're close, we will be sure to share that information through our networks. We are not the only one working on this issue. There are a number of wonderful national state groups that are working on this issue as well to make sure that school nurses can bill for services delivered to the general student population. So I'm sure we all will be sharing that information through our communications networks, and our hope is that we would be doing a webinar on the topic, and it's also, I should say, it's just the first step towards billing, and that clarification is a huge piece of making sure that school nurses can get reimbursed for the services that they are delivering. A huge piece of that puzzle is making sure that there's the infrastructure in place to bill, making sure that everybody knows how to bill. So it's a first step. It's an important step, but it will be continued. There'll be a need for a continuing dialogue and continuing training and work around the issue.
And, or Erin, do you want to jump in?
Only to say that we too will help with that dissemination because we know it's so important and are watching for it. So Yeah,
Great.
stay tuned.
And would you, as a follow-up, would either of you like to comment on the question of would updates to the free care rule, would that require a change in state plan amendments?
That is a good question. I'm actually not sure of the answer to that, Erin. I don't know if you know. That's something we could definitely look into to see if that's the case, and then we could include that information in the follow-up email.
Yeah, I don't know either. So great question. We will find out.
We don't have all the answers. All right, I have a very specific question. This is probably for Erin. Do you think Nemours would have something for Pennsylvania nurses? One of the nurses here is in Pennsylvania, and many of their families are working with Nemours.
You know, they might, and I know that Nemours, sorry, I probably pronounced that one wrong too. They are writing up some of the information of what they've done, and I know they have been open to talk about it. So I could try and connect the two for you guys to have those discussions because it's done at that local level.
Mm-hmm. Okay, great. Here's a question. I'm actually not sure of this question, but I'm going to ask it and see if anyone has an answer. Are school nurses ever included in ARDs as part of the care team? I've never experienced their involvement, but it would make sense. I'm not clear on what an ARD is. So Nina or Erin, are you aware of this?
I'm not sure what the acronym ARD refers to either.
I wonder if it's a typo. So if Melissa Scarborough is still on, if you want to follow up, we'll try to get to that one. So let me continue. By the way, this one actually isn't a question, but I will state it regardless because I like this comment. OMG, Nina, that was fabulous. So here's a broader question. How easy or hard do you find to get school administration on board with community collaboration?
Well, from my personal experience, almost impossible. Our school administrators right now are so burdened with test scores and trying to meet their own ARP and that kind of stuff that they have to do that really it almost seems that not that students are out of their mind, but the impacts that are impacting students just don't dawn on them very well. And so I think, and that's part of the reason why we are reaching out more to the healthcare community at this point, because docs get it. They understand. And administrators are willing to work with us if we have doctors on board and that kind of thing. But it just seems like school administrators, at least the ones that we've been working with, are, okay, that's good and that's all good, but how's it going to impact me? And as long as it doesn't impact me a lot, then you guys can do whatever you want. And I think it's going to take a while for us to be able to prove to them, look, because you had this school nurse in your building, these are the things that have been a positive outcome for your students and thus then reflected positively on you. And at least right now in Oregon, we don't have that data to show them yet.
I just want to add on to that. I agree 100% with what Nina said. I always have thought, many of my siblings are educators, and we've talked about this a lot. It's almost, we talk about cultural competency in regards to a different culture, maybe a different race or ethnicity or someone from a different country or something. But culture in a very broad sense can be applied here, that it's two cultures. It's the education culture and the health culture. And so what Nina was saying about sometimes, they have their own concerns and their perspective of how, and so it just honestly doesn't dawn on them sometimes. And so that's where the education and working with them in a variety of ways I think is important, but realizing that they literally sometimes speak a different language in regards to terms that we use. A really quick example is I heard of a nurse that went to talk to an administrator. She was worried about a student who was cutting and went on about how it needed some mental health services and to get at the root of the issue, and the administrator just looked at the nurse and said, well, what's the big deal? Cutting class, we can work on that. Well, the nurse was talking about cutting as in physically cutting themselves, to very different issues. And so just I think the importance of trying to get on the same page and understand each other is a challenge.
All right, thank you so much. Now we have now taken up an hour and 2 minutes of all of your time, and we said it'd just be an hour. So well, we still have a whole bunch of questions. So I'm going to ask you all, hope to give you permission that if anyone has to leave, I completely understand. But I'm going to open up a quick poll and to say, how much longer are you guys able to stay? So if you can stay a few more minutes, we would love to stick around, try to get through all the questions that are being posted. But we understand that everyone's busy and can't make it. So please take a moment and just answer the question. We'll make a decision on what to do. Well, it looks like as the polling is pouring in, I will 5, 4, 3. If you want to vote, vote now and close. Okay, so just so you all know, it looks like a good. We will keep going, it looks like. Regrettably, it looks like about a fifth of you, 20% of you are going to have to get going, but a majority of you say you want to stick around. So let us keep working on and getting through some more questions. If you got to go, thank you for being here. The questions are still going to be answered, and we will post everything on our website later. So thank you so much. So let's keep going. All right, first of all, so we have a follow-up on the ARD issue. We were informed that an ARD is a group in developing an IEP. It's for students with special needs or learning disabilities. In Texas, an ARD is supposed to include the nurse when orders for health care are involved. It is a specialized education plan meeting for students with special needs. So let's replace the question, state the question again. Are school nurses ever included in ARDs as part of the care team? I have never experienced their involvement, but it would seem to make sense. So, Erin, would you like to take a first stab at that question?
Sure. I think as you read the definition, I think it became clear that I think in some states, and each state does sometimes have their own regulations on this, I do know of certain areas that the school nurse that they're supposed to be included. Now, if they're always included, I think that has been a frustration expressed by many school nurses that they aren't maybe included all the times that they should be. Oftentimes when they look into why, it comes down to kind of what we were talking about before, is it didn't dawn on educators that there was a health component that was impacting, even though it might have seemed obvious from the school nurse's side. So I think that's definitely an area where there could be improvement, but I do know at the same time that, yes, school nurses are sometimes included.
In Oregon, we are a part of, here we're called special education teams, so we're part of the SET team, and it is one of our duties to try to attend those meetings. And we try to attend all the new referrals and then do kind of brief health information during the new referral meeting and then determine if we need to do any further. We are included in IEPs. We are included when we do delegations as far as direct nursing assessment, and then obviously on our medically fragile one-on-one kids that have direct nursing assigned to them. I do think it's vital that we go. I had an experience early on in my nursing which taught me that I needed to try to make time to be at those meetings. It was a second grade referral for this little guy. Of course, they're looking at ADHD because he's inattentive. You know, he's not paying attention. He's flighty. The teacher kept describing him as spacey. And she said at one point, she said, for example, the other day, he got up, walked to the bookshelf during a lecture, and I went over and asked, what are you doing here at the bookshelf? And he looked at me and said, I have no idea. And at that, it just dawned on me, and I asked the family if they would do a follow-up with a neurologist. Long story short, he had an EEG, he had an absent seizure disorder, he's medicated for his seizure disorder and is doing fine. So that's why I think it's vital that school nurses are included in those kind of referral teams. We're also trying to do some pilots with every child that's being referred for a learning disability has to have a full vision screen to make sure that it's just not a student that requires glasses. Some of the statistics are not a high percentage, but we've had 1 and 1.5% from a couple districts of students that were being referred for learning disability that actually just needed glasses. So I think it's really important that the school nurse be a part of that team.
Great, thank you. And just because we're all required to learn at least one thing new every day, ARD, at least in Texas, stands for Admission Review and Dismissal Meeting. Okay, next question. I am a family school nurse practitioner, or in the family school nurse practitioner program at UIC here in Chicago. What can I do? Do you have any recommendations for what I can do to become more active in school nursing? I think this is what might be a good question for Erin.
Yeah, I would say the first thing is I know that Illinois has a very active state school nurses association. I would contact them. They could probably tell you what was going on. There are actually several faculty there at UIC that are very involved in school nursing as well that could might be able to direct you in regards to where your interests specifically are, as well as what activities are going on. There's also the National Association. I have to give a little plug too, that there might be some interest there, but oftentimes locally I know there's a lot of local things going on, and that might be a good start.
Mm-hmm. Yeah, there are some great local leaders here in Chicago, so we will try to make some connections. How about, here's another question. Have there been any successful reimbursement models for school nursing and asthma outcomes? Anyone?
I can start that. They oftentimes haven't linked the two together like that. There are definitely studies that show improved outcomes when addressing asthma. And I know that there are successful models of Medicaid reimbursement. I'm not aware at the moment that I can think of where it looked specifically at just those two things alone. So I don't know exactly which is the two they want. I do know that with Medicaid, and one thing I actually had forgotten to mention in my presentation, I'll just throw in here, is just to be aware that another change in the Medicaid rule, but this one for sure has to change in your state Medicaid law, was starting in January that preventive care can be reimbursed for non-clinicians that do it. So what that means is, for example, someone who's at risk or someone who has asthma or diabetes or whatever that could really use and benefit from some prevention and some more one-on-one counseling. In the past, the provider has always been able to reimburse for that through the law, but the law was changed to allow non-clinicians, and even though as school nurses we consider ourselves clinicians, in the laws we weren't considered that, but it has to go back into your state law, and the state law needs to change. And I have yet to hear of a state law that has opened up to do that, because of course when the law opens up for one thing, it gets opened up for anything. So directors are very careful, but I did want to mention that that's something that school nurses can really be watching for, because it's a great opportunity to make sure that school nurses would be listed as one of the groups that could be reimbursed for specifically targeting and doing some promotion and helping with those highest at risk, which would include asthma in that respect.
Mm-hmm.
And this is Alex from Healthy Schools Campaign. I do, again, as Erin said, I don't know of any that have linked reimbursement, have made the connection with reimbursement and outcomes, but I do know, I believe there's in St. Paul, Minnesota, they have an interesting partnership where they've become a recognized provider of one of the managed care organizations there, which has enabled them to bill for a handful of preventative services that they provide to students, and some of the asthma services that they provide are included in that, in addition to some immunization work and things along those lines. So, but I'm not sure what impact that's had as far as outcomes, but I do know they've been able to bill for some of those services and get reimbursed.
Okay, let's wrap up. Let's finish up with one final question, and we will have the question for Nina. So, Nina, how did you engage the school or supervisory union information or IT director to working or linking or sharing student info with providers and vice versa within your pilot project?
Well, what we had to do was the nurses are able to log into the electronic health record system. Our docs are using Epic. So the nurses were able to be given passwords and logins to get into Epic. The doctors are unable to get into our student records. So there's not an interface that way. So physicians can't get into the school electronic records. It's only the nurses that can get into the doctor's system, and just a part of the system that we're allowed to get into. So so we haven't co-linked where the physicians are able to get into the school system at all. So those two have been kept private that way.
Mm-hmm. Okay, great. Well, thank you so much. I think we're going to, with that final question, we'll call it a close. Nina or Erin, would you like to make any final statements?
Well, this is Nina, and I would just like to say thank you for attending. Thank you for being willing to listen and kind of think outside of the box. This is kind of new and exciting, and so it's just one of those things. Sometimes it's good to take a risk, so just be willing to open up those conversations with those people and those key players.
Mm-hmm.
And this is Erin. I just want to echo what Nina said. I agree. I think this is a great opportunity that we have in school nursing. It's a great window of opportunity where with the Affordable Care Act there has been some windows and more emphasis on areas that school nurses already do. And if played right and being active and kind of inviting ourselves to the table sometimes until they realize what school nurses really can do, it's a great opportunity to show how school nurses really do impact the health of a community.
Well, thank you all. Thank you for everyone who participated, who was listening. Thank you both to Nina, Erin, and to Alex. And we really appreciate all your time. We think this is an exciting opportunity, and we're going to do our best to share information, resources, best practices to make sure that we can continue to elevate school nursing and the importance of school health. So take care, and we will be in touch with all of you shortly. Bye-bye.